Hello, this is Ken Rethmeyer, and a few years ago I had the privilege and honor of being faculty for a leadership development process and program in Romania, in Bucharest, for all of the local healthcare leaders. About 25 attended this first session. We've had 3 more sessions since then, and I have a recording of an interview that I want to play for you that I think has some value not only in Europe, but in the United States as well, because of the problems and challenges that we're seeing in healthcare today. It's remarkable. Unbelievably, shortages of key personnel such as nursing as a result of the pandemic. And as a consequence, it's one of those things that we just never could have anticipated happening. So in any event, I'm going to share the screen. I'll play the video. The first slide sort of introduces it, and then we'll come back and see if you have any further thoughts on your own mind. Thank you very much. There's the slide. It gives you a good sense of leadership excellence in healthcare was the model that was created. It came actually from some work that I did with the European Union a few years before that in developing a competency-based leadership model for public health. And interestingly enough, the competency domains, which are the main umbrellas that this model fits under, are the kind of domains that you would find in most any organizational setting, not just healthcare alone, in virtually any industry. So I'm going to be interviewed, and I hope that you enjoy the video. So we'll get started. I think, number one, there are a lot of parallels across the whole world, Europe, United States, Southeast Asia, that are incredibly important drivers of where we are as countries in both our healthcare systems, that's the acute care inpatient systems, vis-a-vis the public health systems. And those drivers are the progressive aging of our populations. And the consequences of the aging process is an inversion, if you will, of the financing of the systems. So if you're a country that relies heavily on the dependency ratio of having more people contributing to the system than are costing the system, that works. But with aging, it inverts and it causes deficiencies. So I think one of the major challenges that we all face is the lack of adequate funding, both in the public health environment as well as the acute care environment. And as a consequence, it creates a diversion away from what we're trying to strategically achieve, both in the short term as well as the long term. And those are significant challenges that we have to deal with and come up with some other ways. It's sort of like plan A, moving to plan B, and maybe plan C or D. I think we have to redefine where our target audience is and the parameters in which we govern our healthcare systems. And I think it has to be more directed to the communities that the individual institutions provide care. And in the United Kingdom, they have tried to do that through competitive or global competition by moving the funding down to local health authorities for general practice. In Romania, we have a situation where there are a lot of independent individual institutions that are not integrally linked in a fashion that allows us to create a patchwork of effective care and placing priorities on those areas where we really need to be paying attention. So for example, in the last couple of days, I've learned about the overabundance of tuberculosis, of other kinds of communicable diseases, the lack of appreciation for the needs of psychiatric patients in a global perspective. And as a consequence, we're not actually building an infrastructure of healthcare services that support the real needs. What we're finding is people are having to react day to day to the lack of adequate resources that they have to achieve their objectives and in the longer term, the goals and the vision for a better health. I think one of the major messages from what I've learned is that when you change ministers of health with the rapidity that has happened over the past 30 years since the independence from the old communist rule, it creates a real problem for the people, if you'll pardon the expression, on the ground, having to deliver those essential services, because they're constantly reacting to new directions. So one year it says, we're going north, the next year we're going southwest, and the year later or 6 months later it changes. And so finding some form of stable, common ground around which everybody can agree an overall direction and allow the local entities to fit within that and develop their own tactical efforts within their communities to achieve what they can. But I think the government has to invest more funds in the healthcare system to make it work. 4.9% GDP is not going to be adequate in today's world with all the chronic illnesses, the lack of continuous care in some areas, the health inequalities that exist, and the needs of young people whose needs are far different than the older population. So we had this diversion of demand, if you will. There are probably a lot of things not to do. In today's world, we have a patch quilt in the United States that is not coordinated. And unfortunately, policymakers they make mistakes by assuming that certain policy directives are going to have predictable outcomes. And an example in the United States is that in the previous administration, they opened up the opportunity for a rapid expansion of Medicaid. And what they didn't anticipate was that a lot of people who had private insurance, but who could also qualify for Medicaid said, why should I be paying out of pocket when I can be on Medicaid for nothing? And what has happened is it's created a funding deficiency in some states that are going to have long-term deleterious effects. So I think one of the things we have to do as leaders, particularly in the political environment, is to better understand what are going to be the consequences and the unanticipated consequences of our policy decisions. And let's make sure that we don't do something that we shoot ourselves in the foot. I don't think I have all the answers, but I'll give you my opinion, having been in this business about 50 years. I think the key is constantly being aware that we have to have our sensors out, monitoring the environment, and ensuring that we truly understand what is going on, what are the dynamics of the healthcare system, and as leaders, not how we direct our approach, but how we facilitate and bring people together for the common good to create uncommon results, as opposed to thinking that we have all the answers. We have a different kind of style of leadership that needs to be more inclusive, if you will, to pardon that political pun, and incorporate people in a different fashion than we have in the past. And that change is tough for us old folks. And for people who are learning, we want to set them standards that they can achieve and effectively emerge into new roles and adapt accordingly. We have two different kinds of programs. We have health management programs in our schools of public health. And then we now have healthcare concentrations in management in our schools of business. And what we're finding, because I've seen both in North Carolina, where I'm from, the University of North Carolina is a school of public health that emphasizes global health administration. And Wake Forest University, where I live nearby, focuses on their School of Business with a track that parallels the track that UNC offers. And so there's a lot of common ground. And I think cross-fertilization between those kinds of educational environments is absolutely critical. Otherwise, you lose the opportunity to learn from one another. And I think that's where we need to do a better job. How do we create an effective network that weaves together all of the various components in a consistent fashion? I can tell you one of the big negatives in the United States is that the public health community is not as respected as it should be. And it's not contributing to the overall needs of our healthcare system as it could, because of this digression away from what we ought to be paying attention on. In Europe, public health has a much higher status, if you will, and they need to leverage that to show the acute care market that they can be a very effective partners in achieving both short-term goals of meeting community needs, but also looking at the longer term and those strategic objectives that we're trying to accomplish.
I hope you found that useful. For me, it's been a great opportunity to work with the people in Romania and 7 of the Eastern European countries, including the Republic of Georgia. And initially, I was doing it through Project Hope, teaching healthcare management, and then transitioned with a faculty appointment at Maastricht University's Department of International Health, and I continue to mentor patients. For me, this has been a real blessing in my own career and an opportunity to apply a lot of the tools you would find in the book up on the left-hand corner of the screen. It's available out on Amazon. For me, leadership is a journey. It's not a stop and go. It's not like an A6 pilot where you come in, touch the runway, and take off. Leadership is a journey. It's a long journey. And I want to read a quote that I wrote some years ago. I hope you don't mind. I will close on this comment. True leadership is about new ways of thinking and relating. And by doing so, you will be recognized by the quality of how you conduct yourself, the caliber of the programs and interventions you create and lead to deliver real value to your team, your organization, and most of all, the depth of service to your community. This is what we call value-added leadership. For me, as a leader, if every day I can come home and look around and say, today I had meaning, my team had meaning, my organization had meaning. We delivered on our healthcare. We delivered what we were doing in industry standards. And then also it was meaningful. And that's how you feel about yourself. And great leadership, and it's a great opportunity. I wish you all the best. And I hope to see you soon again on a podcast. Thank you very much.